But
it is interesting too, where we ask questions and it's almost like people put walls up. Like a very common thing, I don't know if you hear this from your patients, but in the world of chiropractic, I hear this all the time. They'll list their symptoms. Oh, I have back pain, and my hip, and my knee sometimes hurts, and then they'll follow it up with, I know exactly what it is. And that's like a sign for high anxiety, low knowledge. To me, I'm like, that's a red flag. Usually, I've never had anybody say I know exactly what it is and then immediately tell me the right answer. It's like, I know exactly what it is. I was in the garden the other day and 2 butterflies landed on my arm. Like, I know that's why I have back pain. And you're like, what? Like, how are you even doing that? But I wonder if that's like a defense mechanism because they are scared to hear your version of what it is,
Yeah. Well, it's scary to not know about your own body.
Right. Yeah.
Like, what a wild sensation that we carry around this, like, tissue and bone, and we, like, don't understand the language of it.
Sure.
And then someone else is like, oh, I know the language. I can unravel it. Actually, it's been speaking like this language. And they know, and you're like, why don't I know that? That's wild.
Right.
I've lived with this body.
So going back to like your journey of getting knocked down, pursuing yoga, take us through 20-year-old banged up, broken Mel into you becoming an osteopath. Like that. Yeah. That sounds like a weird,
a weird pathway.
Yeah. A weird pathway with a great ending. But like, how did that occur? Because I'm guessing it had to do something with you trying to figure yourself out.
100%. Nailed it. Yeah. So I was very lucky that there was an athletic therapist that was involved in the rugby club. And when I started kind of working with her with my original injuries, she was going to school to become an osteopath.
Okay.
So she was always trying all of these different things with me. And I had never had someone sort of address like my IBS or like, let's talk about the anxiety. It was always like, hey, muscle, like, let's do this, or injury here. Let's do this, like one specific area, one technique. She was really opening it up to all of the different elements and symptoms that I was experiencing. And I met her at, 17 years old, and I worked with her consistently every single year. I probably saw her every 6 to 8 weeks, maybe 2 months for every single year until I moved here, which was about 8 years ago. And I love every modality. I think there's so many beautiful things about everything, but there was something about going to her, the relationship we developed, the fact that she had known me for so long. She knew the sport really well. She offered me a lot of insights into my body that I didn't really know. And it's a steep learning curve when you're starting to sort of push back. You're told like no pain, no gain your whole life and just like push through.
Especially in like rugby. Rugby's a hard hitting sport, right?
Yeah. Yeah.
I mean, nobody is leaving the rugby field after a match thinking, I feel fine. Like,
no.
Like I didn't feel anything,
Yeah, no, that's literally impossible.
Yeah.
I don't know how you would do that. It's like the equivalent to having, I've heard, like 3 or 4 mini car accidents. You're just getting smoked. And like, I'm 5'10". I'm like a slenderish build. So I got destroyed on that field all the time.
Long limbs and height are great in volleyball, but not so much in rugby, right? You want to be built like a fire hydrant, like.
Yeah. I was like a Muppet, just like limbs everywhere, grabbing balls, grabbing jerseys.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of trust-driven care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust-driven insights, real conversations, smarter care, stronger business.